WCLN 1170 Radio and Star Vision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. We're coming to you on WCLN 1170 Radio, Star Vision TV. We're replayed on 7 p.m. Tuesday, Wednesday, and Thursday. There's a reprint in the Sampson Weekly newspaper, and we're pleased to tell you we're now uploading the shows to YouTube, and we've had, believe it or not, listeners from various parts of the world. It's already tagged us and taken a look at some of our shows, so we encourage you to use that medium as well. We're trying to get information out that you can use. It's going to benefit your life, hopefully give you a better understanding of what's going on in the world around you and things that impact you on a daily basis. Today's show is one of those shows, and I will go ahead and ask you up front, you might want to call a friend, a family member, tell them to tune in. We're talking about pharmaceuticals, we're talking about Medicare, we're talking about things that touches your life in some way or the other every day. I want to thank Jimmy Matthews for being with us. Jimmy, thank you for helping bring this program to us today. Something that you and I have talked about a number of times that we need is more information, especially if it relates to pharmaceuticals. And we have Kim Reed with us. Kim, you're an East Carolina graduate, and you're here now with the North Carolina Cooperative Extension Service. A number of things you're involved in, particularly Family and Consumer Science Agent, I think is your title. You're involved in Medicare specialties and those kinds of programs. You're teaching some classes. You're also involved in health and wellness. I'm going to ask you to tell us a little bit more about you, and then I'm going to get back to Jimmy. I got to ask him a couple of questions, but let's tell us a little bit more about you so folks can get to know you a little better, because I want them to feel comfortable with you, because hopefully they're going to call you with some additional questions after the show.
Okay. My name is Kim Reed, and I'm originally here from Sampson County. I went to Harger Elementary, but we had to move 5 or 6 years later because of I-40. And we moved to Wayne County, and I've been there ever since. I graduated from Southern Wayne High School and went on to East Carolina, and I got a degree in child development and family relations. And after graduation, I had my internship with Cooperative Extension turned into a job, and I've been with Extension for 12 years. And also currently, I'm working towards my master's degree at North Carolina State University and a degree in family and youth management program.
Well, again, thank you for being with us and to talk about this subject of Medicare. Jimmy Matthews, you're always on top of issues in the community. You serve this community well. Matthews Pharmacy and the gift shop across the street there got a lot going on, and I appreciate you taking your time, because I know without a question the number of times I've stopped at your place, you got a busy shop over there. Thank you for coming in. I kind of make the assumption, Jimmy, that everybody kind of knows you and knows about you, but to use your name in the same phrase as Carolina is pretty much okay, I guess. So tell us anything. I'm just going to give you. I'm going to give you a mic moment here to just say, go ahead and tell us about Jimmy Matthews.
Well, born and raised in Sampson County, I had a dream come true, and was able to come home and go into a family business, pharmacy, and been here ever since. And it is a dream come true to come home to Clinton and to be a part of this community. What I remember from growing up here were all positives. People working together to help each other and to make things work. And seeing us come from a rural county with a lot of economic challenges to a county still with challenges, but with such a bright future and things going so well for people who live in this county. You know, we could talk about that in a program, what the economy was like in the 60s and what it is like now. And so just very blessed to be back here. And I want to give Kim a little bit of an introduction to help people who also know this county for a long time. Anna Peel worked in the job that Kim's doing now. And when Anna talked about retiring, I went, oh no, this can't happen. And because we did count on her a lot for a lot of things in this county and being so active, not just in things that touched my business, but in other things that we did. And I thought, boy, how will we replace her? But particularly with Part D coming on board and with all those challenges, I thought, man, this is not good. And I am just delighted that Kim is here. She has a feel for who we are. As she said, she's from the area. She knows the challenges that our people face and is so available and so helpful to people. And so just delighted to have her here to help talk about this challenge that some of our people in our community have.
And you know, Jimmy, one of the reasons I think that we're talking about this today is that you and I had a discussion, and because of the kinds of things that you see at your pharmacy, folks coming through, there's a real challenge for people today to be able to sustain their pharmaceutical needs and also have food on the table.
There is. You know, the economy's been challenging. We certainly hope it's going to get better. We see signs it's going to get better, but that's not going to happen overnight. And people have used up a lot of resources. As I was just talking to Kim, also people are inheriting family members kind of back with them during this tough time to kind of make things work in their household. And so those do add some additional challenges. And what we have seen is that, you know, when people are unable to afford medicine, eventually that cost increase because they end up in the hospital or in the doctor's office more, because they are not able to what we call comply, take their medicine, you know, all the time the way that it should to keep conditions under control. And we are seeing that happen. And so how can we help in that? To me, there are two phases. As we talked about, this economy is better, but the folks who are 60 and older, those were people who paid a dear price when this economy was not great. Therefore, what they draw in Medicare is not a lot of money. They didn't earn a lot when they were working. And then there are people who work in jobs that have been replaced or removed or whatever for a short period of time. And there's some needs that they have too, and we're going to touch on that. What if I'm not a senior? Is there help for me on my medicine? So a lot of good things to talk about today that we think directly benefit our people in our county.
Kim, let me turn to you and ask you, why should we be concerned about, or why should we know more about Medicare? If we're not, say, in our 60s or reaching Social Security age, maybe you're in your 40s, 50s, or there's folks listening to this show who are in their 30s. Why should they be concerned or know anything about Medicare?
Well, they should be concerned because I think if they evaluate or just think about family members or co-workers, there's somebody that they know that has Medicare who benefits from Medicare, and you don't have to be 65 to have Medicare. If you are, there's a lot of people. I saw a young man, he was 23 years old and he had Medicare, because you can be on disability. So there's a lot of people that are sick and they're unable to work, and so if they are unable to work, they can qualify to get Medicare because they're disabled. So it's not just a 65 and older issue. It's a lot of people that are 65 and under that have Medicare benefits in this because they're disabled.
So for those folks that may be tuning in today and listening as we start this show, they need to think about it. It's not just for senior citizens or older folks. They need to listen very carefully, because as Jimmy just pointed out, they can really be in a situation to save a lot of money, and there's kind of a threshold there. They understand that, you know, you can step up and participate and be part of it, or you can just kind of stay there and suffer and end up not even having hardly food to put on the table. Jimmy, you see that a lot with a lot of your folks coming in. Do you see that in which maybe sometimes you look at it and tell folks, look, if you do this, this may help you out some?
JW, and to expand on what you just asked, the other part of that is too, everybody in this county, regardless of your age, knows somebody in that category. A lot of us have family members, and they get mail on top of mail that's so confusing to them that it really gets them to the point that they don't know what to do and how to respond to an issue. And it gets frightening to them. They're afraid they're going to miss something or they're going to do something wrong, and you do see that happen where I respond to a telephone call, not just mail, but people. There are people marketing who call, and all you've got to do is say the wrong thing, and your phone service can be cut off, your policy can be changed, and then you go into the pharmacy or the doctor's office and they say, oh, but this is different from what you had last year. So we need to be resources. If you don't have family members, we're all a member of organizations or churches where we have seniors that need help in dealing with this. Because where a lot of people do live where their family lives, in this global world we live in, families they're divided. I mean, young people leave the community. They're not in the community for their parents like they were at one time. So you've got to be a resource to help those folks. And what you see is this is a very proud group of people. They came through things that we can't even imagine. We get upset with what's going on now. These people lived through the Depression. They lived through World War II, where they were rationed things that they could and couldn't have. They made do with things that we can't imagine living without and not having available. So you're not going to look at them. They're not going to come cry on your shoulder, but you can watch for and see telltale signs. And you can ask questions. They will share, but they're not going to beg for help most of the time. You see I'm not compliant. You realize that Mrs. Jones lives in Harrells, and the only doctor she can see is in Clinton, and the pharmacy she uses is in Clinton. How does she get to Clinton? That's 25 miles. Now, I'm going to tell you, most of them do not drive. They do, for a large part, have people who will help them, but I have been told it costs me $20 for somebody to bring me to town so I could get my medicine and my groceries. Now, that sounds cruel, but it does cost to drive a car today. So maybe it's just covering the expenses. But when you take $20 out of an $800 check, and if you have to do it more than once a month, that's huge. That is getting to be money that I can't spend, because remember, it's cold outside, I got to have heat. I got electricity, and I need that. There are so many basics that we all have to have, and they have to pay for part of their Medicare a lot of times, and whether it be health or prescriptions, and that's what we want to talk about. We first became aware of this when the North Carolina put their plan into place. We'll talk about that now.
Yeah, we're going to continue discussion and talking with Jimmy Matthews and Kim about Medicare. We'll be back in a moment. Call a friend, tell them to tune in. Stay with us. Ladies and gentlemen, welcome back. The name of the show is We Should Know. Tuesdays, 2:30 to 3:30. Star Vision TV, 7 p.m. Replay on Tuesday, Wednesday, and Thursday. There's a summation, a summary coverage of this in the Sampson Weekly newspaper. Comes out each and every week. We want to encourage you to listen to the show. We have also a website, We Should Know. If you have comments directed to us, questions that, or maybe new shows you'd like to see, we should know edu@gmail.com. We should know edu@gmail.com. A shout out to some of those folks out there that keep you abreast on what's going on in the show. It's Boogie Shoes, Robert Stroud show on Saturday afternoons, and also now Friday afternoons. Robert's on the air. Also Don with the Country Store each and every day, Monday through Friday on WCLN, and Wayne Weeks with the Southern Gospel Hour. We have to mention those because they're big supporters of our show and oftentimes listen and give me comments and feedback. We're talking today about Medicare. We're talking with Jimmy Matthews, a well-known pharmacist here in Clinton for a number of years. Kim Reed, who is a person that's been working in a place called the North Carolina Cooperative Extension Area. You're in the title is Family Consumer Science Agent. That's a huge title, Kim. Jimmy, we're talking about numbers as we went off the air. The numbers that we look at is how much money a person has to deal with everything from drugs to food to light bills, all of those other things. So, Kim, let's talk about some of those numbers. When we look at Medicare and the potential of how much money a person's left, how does that weigh out when we look at the numbers?
Let me ask you a question.
Go right ahead.
A customer would ask.
Go right ahead.
See. All right, Kim. I had this limited income, and we looked at numbers here. Individually, it can be $1,000 or less that I would draw monthly, and I'm having a time paying my premium because I do pay my premium if I'm on Medicare, and my Part D, I just don't know if I can continue it because it's running $30, $40 a month, and then my co-pays, and then there's the ever famous donut hole. I'm going to have to drop my Part D that means I've got to pay the full price. Because I can't afford that, I've got to take my chances. If I come to you and I'm drawing $1,000 a month from Social Security, what is out there to help me with my co-pays and my premium? So what would you tell me?
Okay, through the Social Security Administration, they have the Extra Help program, and it is called the Low Income Subsidy program. And there are guidelines that you have to qualify to see if you can get assistance with paying your Medicare Part B premium, also your Part D premium, and also help with the cost of your medicine. So if you have, say this was Jim who came in, and it's just Jim. If you are single and if he said he makes $1,000, he would qualify for this program, and so instead of paying $40 for a bottle of medicine, it would go down to, let's say that medicine was a brand medicine. And sometimes your brand medicine can be $40, sometimes it can be $300, depending on the type of medicine. He would now qualify to pay only $6.50.
Significant savings.
That's significant savings, from $300 to $6.50, because under the guidelines, if he's an individual, just himself, if he's single, and also it looks at, any kind of property. You don't count the house or your car that you're driving, but if you own any extra land, and if your land, the value of it is no more than $13,300, you would qualify. And so instead of, like we said, instead of paying $200 for a medicine like Plavix, he would pay $6.30. That's the full cost of Plavix.
So, Kim, there's a formula that you go by,
Correct.
and each individual is on an individual case basis.
Yes.
Jimmy, I particularly like your role play on that, because it tells me you've had somebody or a number of people that come in and that have these kinds of prescriptive issues.
Well, and the other thing I would ask him, okay, thanks for the copay help, but now my premium is $50 or $60. Will this program defer any of my premium payment too?
This program, under the guidelines, it can help pay for his premium for his Part D, and if you also qualify for other programs, it can also pay for the Part B premium, and that will be the Medicare Savings Program to help paying for that Part B, because a lot of people are under this the assumption that Medicare is free. The Part A is free, and Part A is for hospital, because if you worked at least 40 quarters, which is the equivalent of 10 years, your Part A is free, but your Part B is not free. And so your premium for that could be anywhere from $99 to $115. It just depends on when you started your Medicare card became effective, how much they're taking out of your Social Security check. So you can get that money put back into your check if you only make a limited amount of your income.
And you mentioned this a while ago too, Kim. One of the reasons folks need to really listen carefully to what both of you guys are saying is that they may have a family member. It may be a mother, it may be a father, a grandmother, grandfather, some person that's older than them. They may be 30 years old, but they may be looking at this program and going, wow, I can save grandma, grandpa, uncle, aunt this amount of money, because they may have been supplementing them and helping them. So it's a broader picture than just saying a small group of folks, well actually it's a large group now with the baby boomers, but a group of folks 60 and older. It really is impacting everybody in somewhat a negative way financially if we don't know these things.
Well, now Kim, you got me really excited here about this program, but the real demon is that gap. What happens to it?
Okay, so he's talking about the Medicare,
donut
hole,
yeah.
the coverage
gap.
gap. What does that mean?
That means that you start into your Part D, and you sometimes have a deductible up front, maybe up to $100. A lot of them don't start with a deductible. You just start paying a copay, but there's a total cost of that medicine too. So what they track is the total cost of that medicine. And once I reach about a $2,500 total outpay, not just what I pay, but what the insurance company pays as well. Then I go into the gap, and I stay in that gap until I've had an outpay of, what is it now, $13,000 or something. It's sizable. That means, and at that point in time, I have 100% copay on all my medicine. If I'm taking that Plavix and it's $297, I'm going to have to pay the $297. If I'm buying a generic and the full cost of it is $34 and I've been paying $2 or $4 or $6, I've got to pay the $34. And so that is huge. And if you hit that gap anytime from July on, you will never get out of it for the rest of the year. You're going to be paying 100% copay. And that really is when people have to start making tough decisions. And so that, best I remember from seeing, sometimes that gap goes away for me and my copays continue, but I don't have to worry about that gap if I get this assistance. Isn't that right, or am I wrong about that?
Yes, if you qualify.
If I qualify. Now, that doesn't mean everybody, but right. I mean, and so I could all of a sudden, be paying $10 or $25 a month for my medicine with my copays, and then which would be more than that really. I might be paying $100, but then all of a sudden I'm paying $500 a month because I'm in that donut hole or the gap, and that's going to continue. The only way people get out of that if they have a lot of expensive medications and they can meet that gap by April, but still they've got 2 months, 3 months of paying a lot of money out, and that's a real tough one, and that's where these programs come in to help so much. And I want to reemphasize something to people. I know you can't tell about watching TV, but I can draw Medicare, and I'm on Medicare now, and have chosen to draw my Social Security even though I'm still working. And what impresses me is I know how much money my salary was. I know how much I draw. I know how much money these people made when they work really, really hard. And so your Medicare, Social Security is based on what you earn, not on the era that you're living in. These people worked in an era where a gallon of gas was 32 cents a gallon, not $3 and something. And so now you know what they're making and what they're drawing. And they're having to buy the same drugs everybody else is buying in this marketplace today. And there's no exception. So to me, it's great to have this here to supplement these people's income who did not have a lot of support and paid a tremendous price for this country and helping us survive some very, very, very tough times. So it's something that we love working at, and seeing our patients come in the pharmacy. That's part of the fun. I mean, filling a prescription and making sure it's right, those are the things we do well. But I tell our people, you look at that copay, you see what that person's paying. When something starts looking odd, where are the things that we can reach out and help those people lower that expense to themselves and make it possible for them to continue to be our customers throughout the year and not just for the first 3 or 4 months of the year. And so these programs are just really, really special for people in our area because we live in a very special area.
But Jim, there's something that he does at his store. He also makes sure that he's trying to give the community a break as far as on the medicine. He has a $4 list to help them with their generic medicine, which is very helpful because you could go to a different store and pay $10, but you can come to Matthew's drugstore and pay $4 for the same medicine. So, I mean,
I've been trying to get on that list, by the way. For some reason, I can't seem to get
We
there.
save it for the special people.
Exactly. Apparently, I'm not there yet. So.
Well, you know, you can't take credit for that. I mean, this program, something like this was started by some of the chains 4 or 5 years ago. And I looked at that and I said, you know, I can do that, you know. And then we looked at, well, do we just play with the few drugs? Well, I said, no, we're gonna go from top to bottom. So
we're going to take another break, guys. We're going to be back in a moment. Ladies and gentlemen, stay with us. Call a friend. Tell them we're talking about Medicare, pharmaceuticals, the two people in the know, sees it every day. Stay with us. We'll be back. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We're glad you're listening to us today or watching us on Star Vision Channel 16. Very important subject today. I encourage you to call a friend, a family member, somebody, tell them to tune in. We're talking about Medicare. We're talking about pharmaceuticals. Two people that really know. Jimmy Matthews, you're very passionate about this. We appreciate you helping us get Kim Reed on. Kim, you are the specialist with Cooperative Extension that deals with Medicare on a daily basis, and you're kind of the go-to person if somebody wants to call in. Give us a telephone number.
It is 910-592-7161. If you have any questions about your Medicare Part D or any questions about Medicare, if you have questions about do I qualify to get some help with the high cost of my medicine, I will be able to answer those questions and help you connect you to the right place.
Okay, and then just call that number and ask for Kim Reed. That's R-E-I-D, Kim
Correct.
Reed, and you will answer those questions. Jimmy, off camera, we were just talking about a while ago the whole issue of the dynamic, the huge financial cost of these kinds of things, and you see that every day, obviously, and you've got a good heart for the people in this county. You're always have tried to look out for folks. So as you look at that, I can understand why you would be passionate about it, because some of these numbers that we've talked about is just huge. I mean, we're literally, and a lot of folks may not, there's people out there that's listening to this and going to really understand it, but we're really talking about food or medicine.
Right.
And when you put it in that perspective, it gets real for you. There's a program, though, that you mentioned that the health department has got now, a prescription assistance program. You guys want to talk about that?
Yeah, we'll play the role model again.
Yeah, do that.
We'll let Kim.
I like that. I think that works good. Kim seems to work well with it.
Well, Kim, I'm working.
Okay.
I have a job. I make $10 an hour, but I'm on this drug that's $250 a month, and I have 2 kids at home. It's tough. I have a tough time doing that. Now, I'm going to give her a little lead in, because a couple of years ago, the health department here took a step out that from some other counties that were doing this and put together a prescription assistance plan. And so I'm going to get Kim to find the cheat sheet over there about what the guidelines are and tell me if I would qualify for some assistance.
Okay.
And so remember, I make $400 a week. Okay. That's $20,000 a year.
Okay.
There are 4 people in my family.
Okay.
So would they be able to help me at the health department?
Yes, underneath the guidelines. The prescription assistant program, it is sponsored through the health department, and the guidelines are you must be a U.S. resident. Also, you might not be eligible for any, if a patient is not eligible for any other type of prescription coverage for that particular medication, including Medicaid, VA, or private insurance. Your household income must be less than 20% of the poverty level, and we do have a chart, because some people say, well, what is 200%? Mm-hmm. So a family of 4, the 200% would be they can't make over $47,100. Mm-hmm. So they would qualify. If a family of 4, if they only make $47,100, they would qualify.
That's real
to get help.
Well, yeah, and let's go around. I mean, now remember, I gave you $10 an hour. Mm-hmm. My income is 20-some thousand. What did Kim just say? My income could be $47,000 a year. That means I could be making $15, almost $20 an hour at my job. Maybe it's a job I'm contracted out and I have no insurance to help me at all with it. There are a few exceptions, things that I can't have. But I mean, in our county, I think the income level is $25,000, when everybody's taken into consideration.
$47,000 is huge income when you consider the mean income for this area. And
Right.
I'd say this part of the state. So when you see those numbers, it really shocks you to think, wow, we got a lot of people that would, benefit.
A family of 4 making that, they could qualify for 200% underneath the poverty level. So they would qualify for this program.
If I've got 6 people in my family.
And 6 people in your family, if you make $63,180.
So, and I think to put that in perspective, that's probably a household income.
That's a household.
So my wife and I both could be working at a $10 or $15 an hour job and not have benefits and might qualify for this kind of help.
Very close.
So, and most of these are branded drugs because the manufacturers underwrite this program. And there are some criteria other than just income. They have to have a program in place at that company that helps and underwrites these type of programs. The beauty of that is you call the health department, another phone number. And if you don't remember them, call the drugstore. We will refer you there. We don't have all the answers, but we got the numbers. Mm-hmm. And that number is 592, what is it now? 1131. 592 1131. And what I was told today, just wait for the little question or answer to come up and hit 0 for operator. And tell them you want to talk to someone about the drug assistance program or prescription assistance program, and they'll put you in touch. They have a staff member there on Monday, Tuesdays, and Thursdays from about 9 to 4. And you're probably going to have to go in, but you could call and set up an appointment. There's going to be some paperwork to fill out. There's going to be some things you've got to bring in, like a list of medications and things of that nature. And it takes 4 to 6 weeks to get that in place. So you'd like to kind of anticipate you're going to have a problem and be prepared to meet your needs until that can get started. But once it starts, it goes for at least that year until you would have to re-qualify again. Again, somebody asked me this, why do you want to send people there? They're your customers. Well, this is going to get down to this. They're either going to they're going to have to get that medicine somewhere, and they're going to use up all the money. If they don't have any money, they're not going to be my customer at all because they have no money. If I can help them take the heavy burden off, there are a lot of drugs that they're not going to be able to get that way, and they're going to be able to afford to buy them, from a local pharmacy. And so it works both ways. It comes around. You keep that patient, you help them, and we even do. And there are things available. If you've got a computer, you have a drug, you need to type in something and go to Plavix Assistance Program. Mm-hmm. And it'll bring you up. There's a lot of junk there, but there's some good things too. And at our pharmacy, we love for the reps to come in and bring us coupons for people and that will qualify, and to be able to help them right there on the spot with coupons. A lot of doctors' offices will give them out as well. So there are a lot of ways to get some of these drug-branded products that you can get assistance on. But I think people need to know it's not just Part D that's got something out there, which I think is huge because I know the numbers that are out there. But also people who are younger, who are working hard, but have some expenses too that are hard for them to meet in the areas in which we live. So first of all, you got Part D that Kim's an expert on. Then we got the program at the health department that they put into place and have actually gotten a new grant for this year, which is allowing them to staff better and to be better prepared to help people. And then there are the coupons that are out there available that people can help you get a handle on. I mean, our techs at the store are really good about, I got to turn to them and say, did you see this copay? Is there a coupon out there? And they know exactly what to do. They get to work and start looking, and they'll say yes or no, and then we'll have an idea of how we can help that patient with that cost of that medicine.
That leadership model permeates down through your organization. I think each and every person there is all about trying to help the customers at Matthews Pharmacy. I will attest to that as a customer there. Kim, just a question for you. We've been talking a lot about Medicare and that term, and we've talked about what that means. But the reality is, again, let's get back to just a basic question. If you draw Social Security, you have to have deducted from your Social Security check Medicare. Is that correct?
Yes, a lot of people, I mentioned it earlier, they think that Medicare is free, but that Part A is paid for with 40 quarters of, that means equivalent of 10 years that you work. But at Part B, there is a premium that you pay. It is taken out of your Social Security check.
Now, that doesn't matter. If you have an insurance policy,
Correct.
If you have two insurance coverages, you still have, if you draw Social Security, you still have to take Medicare as your primary at the age that you draw Social Security, which is 65 or whatever.
Right.
See, I think that's a little bit confusing, Jimmy, to a lot of people because they look at it and go, wait a minute now, I've got insurance. Why do I need the government's insurance if I'm paying for insurance?
Well, a good example of that, if you're a retired state employee.
Correct.
Now, they can retire after 30 years. Is that right? So if I go to work for the state at 25, at 55, I can retire. okay? And I'll keep that insurance. But once I turn 65, I'm going to have Medicare's going to be my primary. My state will still be in place, but it'll be my supplement at that time. Just like I had to go out and buy a supplement policy to take care of that 20%, or those things that Medicare does not cover. So state falls to that.
Yeah,
that
but the state policy becomes your supplement.
That's
policy.
right.
So the good news is the state employee would not necessarily have to buy a supplement policy.
But Medicare becomes your primary, and you're something like your state
Is your
employee. That's your secondary insurance.
Or if you have to buy one.
And if you have to buy one, that will be the supplement. And just because you have Medicare and say Cigna, that's something that your employee guarantee you after you retire. That doesn't mean that it covers that 20% that Medicare covers. It could cover only 80% of that 20%.
So you still got a gap.
You still have you may still have a bill here and there, even though you have two insurance. You have Medicare and you have your state health plan, or you have an employee group plan that you retire with. You still may have a bill here and there. And a lot of people are concerned about that because, well, I have two insurance. Why do I have a bill?
Yeah.
Yeah.
And you can see where that question would get a little bit frustrating to the average person out there.
Correct.
And I think the thing is what we're going through with this and the subject we're talking about today, and when we come back from break, we'll talk about this a little bit more, but with the national health care plan that's out there, folks are getting extremely confused. So let's take this other break, and we're going to come back and talk a little bit more. Stay with us. We're talking with Jimmy Matthews. We're talking with Kim Reed about Medicare, about the must with Medicare, and what you need to know. Ladies and gentlemen, welcome back. The name of the show is We Should Know. It comes to you on WCLN Radio, Star Vision Channel 16, summation in the Sampson Weekly newspaper each and every week, 2:30 to 3:30 on Tuesday, 7 p.m. Tuesday, Wednesday, Thursday on Star Vision Channel 16 TV. Also, if you will go to YouTube, there's a number of our shows being uploaded to YouTube. Just type in We Should Know EDU. It'll bring it up. You can take a look at the shows there. Believe it or not, producers told me that we've been getting hits from all over the world on some of our shows. So makes us kind of proud that the information is getting out there, and hopefully folks not only around here but everywhere else is benefiting from some of the things we're talking about. Today we're talking with Jimmy Matthews, a well-known pharmacist here, Kim Reed, who works with Cooperative Extension, talking about Medicare, talking about how it impacts lives. It went off the air, and a while ago on break we were talking about some issues related to this must-do kind of thing. Jimmy, when you reach 65, I know obviously you're not there, just a young man right on, but as a person, we won't even talk about that, but when you reach 65, you've got to, if you draw Social Security, now, do you have to draw Social Security at 65? I guess.
No.
So if you don't draw Social Security, you don't have to concern yourself with it, correct?
If you're still working, that means if you're working, you still have insurance with your company, so that's why you don't need the Part B.
Okay.
But as soon as you stop working, you need to make sure that you get that Part B. Because I've had some people come to my office and say, I have a $10,000 bill from the hospital, and it's because they forgot to sign up for that Part B when they stopped working.
So, Jimmy, to clarify that question, then you roll out of a, say, state employee or county employee, and you've retired, but you're still working a little bit on the side, and it comes 65, and you go, well, I just don't know whether I want to draw Social Security now, so you put it off. So, Kim, you're saying that even though you do that, you still need to go sign up for Part B, even if you're not drawing Social Security?
If you are not, if you're still working, and if you're still working, you don't have to sign up for your Part B. But when you stop working, you do need to sign up for your Part B.
So if you're working part-time, even if you're making less than $10,000 a year, you're still considered working?
Correct.
Okay, I got it. Okay,
Well,
these are the kinds of questions I think it's important, because oftentimes we'll give folks information, and I like to give them enough depth of information. Mm-hmm. Now, what we're going to do that maybe a lot of folks don't get, we're going to say, look, if you think of something you don't know, you can get up with Kim Reed, right? And we can get up with her at 592-7176, and all they got to do is ask for Kim Reed, R-I-E-D. You can either answer the question, which is doubt. I mean, it's probably most likely you can. If you can't, you can find the answer and get back with them. Jimmy, how about the pharmacy? If somebody calls you, how much can you help them? I know you don't want to barrage of phone calls, but how much if somebody pulls up at your window and says, look, I got this prescription, Can you tell me something about it? How should they handle that?
Well, probably the best thing to do if you're going to have something that has a lot of questions, first, if you can come in and not go to the window,
right.
It's a lot easier to address those questions not in that situation. But if you can't get out of your car, we'll do it at the window. Window's kind of an express thing and
right.
can tie up. But our people, we actually, and one of the best things the state has is the SHIP program. Mm-hmm. I don't know if that's in every state or not. Is it? Does every state have? It's a senior health initiative that our state put into place, and Kim works with them, and a couple of people on our staff work with them. We're kind of in a different capacity, but our people go and learn so that they can help the people with the questions that they're going to have. We work kind of with them, but kind of outside the loop with the other volunteers that are there. So there's a way to get an answer. And then, of course, if we run into a stone wall, it's 592-7161.
You just do the referral.
And she has a secretary that takes her calls for her and takes her notes for her, and you can leave a message and not that. But we can probably help about 60% of the time, at least to know if they might be possible help for them and to send them to the next level, or just to say to them, I'm sorry, you're not going to qualify, and therefore saving Kim some time as well. But remember, we talked about Part A and Part B, hospital and doctors. D, you have to make a conscious effort to sign up for, and you're going to get enough opportunities. When October rolls around, the mailman becomes your best friend. He brings you more mail than you ever want, because every group out there wants you to sign up for their Part D. And all of those are not perfect for you or appropriate for you. And that is when you do need to touch base with someone who can run your numbers. A lot of private insurance guys can do this. I know Eve Black does an excellent job of doing that for people. We have a girl in our organization that can do that, a couple of them. And then the SHIP people can do that. Kim can do that. They can put your drugs in and say, tell me the best programs for me. Which policy is best for me that lets me shop, and locally or mail order or whatever I want to do, and what's my premium going to be. But that's in October. So the challenge right now is, I've just found out that, boy, I can get help on my insurance. I'm not going to have to pay that high premium. I'm going to get help with my co-pays. I want to go sign up. The bad news is, if you've been eligible and you have not taken advantage of that, if you're 66, 67, and you've passed that first window of signing up, you cannot sign up again until October, which will be good for next year. Right. But the good news is, you now know you could possibly afford that. I need to be proactive when October comes. In the meantime, I'm going to have to do the best I can do, except for some of these other coupons or little things that might be out there. What we're talking about is, if I'm on Part D right now and I'm in the loop, I could get in now and start getting some reductions on my premiums, some reductions on my co-pays now during this year. I don't have to wait till 2014. If I'm not in that, then I know that in 2014, starting in October, I can sign up and things will get better for me in 2014. So those things need to be understood. Kim doesn't need a lot of people coming and saying, I want to sign up, because she's going to have to say, you've already passed that window. Yeah. And I know what you've read, there is a penalty when you have not signed up. But as Kim and I talked about it, it's like a 10% penalty. It's based on a premium that's like $50 or less, usually, not $200 and $300 or $900. So that 10% should not be anything to be concerned about.
Not an inhibitor in any way.
It's going to go away too if you qualify for these programs. You're not going to. You literally won't see that. You won't see that penalty occur at that time. So those are the things that we want people to understand. You need to be proactive and find out where you stand. Find out the basics. And Kim could even answer that on phone with a few simple questions. You can't have $100,000 sitting in the bank waiting to leave it to your grandkids. You're going to, and we all agree that's fair. And as I tell people, that money is put there for you to make your life better. If your grandkids don't get any, they will be fine. But they don't want you to do without, and then they find out, well, I got this money from Granddad, and you know what? He never got to take his medicine. He'd have been here with me now had he been able to take his medicine. So everybody has to take a real practical approach to this and understand there's some wonderful things that are there, and I want to find out about them and benefit me and take care of me as a patient today.
One of the things that, and Jimmy, you just mentioned too, is this SHIP program, and that stands for Senior Health Insurance Information Program. And when the Commissioner of Insurance was here in this studio, Wayne Goodwin, he really was concerned that folks looked at that on the website. There is a significant website with Q&A questions that if you have access to a computer, look at it. If you've got a senior in your family, mother, father, grandfather, you might want to go to the website and take a look at that. And then they can also, as Jimmy said, call you and compare if they don't know anything.
And they have a 1-800 number. It is 1-800-443-9354, and you will talk to a human being. They do have an automatic message from the commissioner, but if they keep holding on, will be able to talk to somebody, a live human being. So that's one of the things they are very consistent with, because they know that, you know, when you talk about insurance and Medicare beneficiaries, they really want to talk to someone who is qualified. They want to talk to a human being, not a machine, and they will be guaranteed that they talk to someone. And this is a number that I call when I come to the to a roadblock or a stopping point. Like, oh, I don't know that question, right. So this is the number that I call, and they always find an answer and always very helpful.
You know, we always go through these shows, and of course Jimmy's very familiar with how this show rolls, but we run out of time too quick. So we're kind of at that point now, we're closing out, and I want to give both of you about a minute to kind of wrap up with any additional things you might want to add that we have missed. So I'll start with you, Ken.
I just want to make sure that everybody knows, if you have any questions about your Medicare or your Medicare Part D, if you're having problems with getting your medication, please call us. We hope to lead you into the right directions where you can get help to pay for that. A lot of times we do, and sometimes we don't, but my number is 910-592-7161, because with the extra help, you do have to qualify. So we can call me up and see if you qualify. Maybe we can help you. 592-7161 and ask for Kim Reed. And Kim will answer your questions. She'll find out the answer for you or get back to you. Thank you for being here. Jimmy Matthews, thank you for being so passionate about things that affect and impacts people's lives right here in this area. You've been doing it for many years. The only thing I got to say is just hang in there, man. I hope I need your advice a long time, so hang in there. Thank you for being with us, and let me give you an opportunity to wrap up.
Yeah, on that note, there have been some awfully kind words said about what we do at our business, and I want people to understand. I know the other pharmacists in this county, they're just compassionate about their patients as we are. They can help you and will help you, and you need to use those resources. I mean, that's why God put us here, to help each other. And again, I know all of them, and I don't know one that wouldn't go that extra mile for their patients as well. And use those resources. We can't let this world go to mail order, internet, and no relationships with people. That's the sad part I see in this life, and is that we do need to count on each other, help each other through challenges in our life. So thank you for making this possible. I hope it's helped someone. If you've heard enough but don't understand, call 592-7161.
Jimmy's now doing leverage to you, Kim. So, Jimmy, again, thank both of you for being with us. We've had a very interesting show today, and as always, we come to the conclusion of these things with probably things we can think we'd like to cover. So thank you for being with us. Ladies and gentlemen, the name of the show is We Should Know, Tuesdays 2:30 to 3:30. Please continue to look at us. Send us your questions and comments. We'll see you next week on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.